Hello, my friends, and welcome back. My name is Tony Appleberg Parks, and I'm a health administrator and clinical document integrity educator from the United States. And I'd like to welcome you to Module 12, which is about integrating assessment findings into clinical decision making. In this module, we will discuss the critical role of integrating assessment findings into clinical decision-making with a particular focus on clinical validation and its importance in documentation. By the end of the presentation, hopefully you will understand how to use your assessment findings to make informed clinical decisions and ensure accurate and complete documentation. I'd just like to remind you, I'm by no means here to tell you how to practice medicine, and the way you do your assessment is the way you do it. However, I do want to give you tips and ideas to help with the documentation side of that to meet CDI goals. So I just want to make sure that that's understood. So let's go ahead and get started. Integrating your assessment findings is essential for enhancing diagnostic accuracy and informing your treatment planning and improving your patient outcomes. So by synthesizing that information from various sources, you can create a comprehensive picture of the patient's condition, leading to more effective and personalized care. And through integration of findings, we also ensure comprehensive and accurate documentation, which is crucial for clinical validation and compliance with, quality and regulatory and all those things. So integrating assessment findings involves several steps. We collect and organize the data, then synthesize it and interpret the findings. And then you apply your findings to the clinical decision making, and ultimately you're hopefully documenting your findings comprehensively. Each and every step is crucial for ensuring that all of the relevant information is considered and not left in your brain, but also accurately reflected in the patient's medical record. So let's talk about the steps of how to integrate those assessment findings. So the first step is to gather the data from your various sources, such as your patient history, physical exam, and diagnostics. You might use standardized forms and checklists that can help ensure all relevant information is collected systematically. And of course, our EMRs kind of do that for us. It's important, but if you're still on a paper system, you might want to consider a checklist. It's important to verify that the data is complete and accurate before moving on to the next step. So let's consider an example of a patient presenting with abdominal pain. You would gather data from the patient history, such as the onset, duration, character of the pain. Also from the physical exam findings, such as tenderness, rebound tenderness, and from the diagnostic tests that you might do, like an abdominal ultrasound or blood tests. Once you've collected your data, then you will synthesize and interpret your findings by combining data from multiple sources and identifying patterns and correlations and considering the differential diagnoses. So by your analysis of the data in a holistic manner, you can gain a deeper understanding of the patient's condition and make more informed clinical decisions. And then after you synthesize and interpret your findings, you'll apply them to your decision making and develop your treatment plan based on your findings by prioritizing interventions based on clinical urgency and adjusting your plan as needed. These are the steps that you perform, I imagine, every day. Effective clinical decision making requires continuous evaluation and adjustment to ensure optimal patient outcomes. So again, I'm sure you adjust regularly. So we'll consider an example of a patient with a confirmed MI. You would develop a treatment plan that includes medications like antiplatelets and beta blockers, lifestyle modifications, and possible surgical interventions like angioplasty, and then prioritize urgent interventions such as administering aspirin or arranging for urgent cardiology consultation. And this is where a checklist might come in on your documentation, because you could have a checklist that reminds you to document your findings, document your treatment plan, document any medications, or I guess that's part of your treatment plan, but any other interventions, and then document any changes or consultations, So maybe you have a checklist there that reminds you to gather all those things in your documentation. As I mentioned earlier, the EMRs obviously have those checklists built in, but if any of you are still using paper charting, you are welcome to reach out to me, and I believe I can provide you with a checklist that might be a useful tool for you. To apply your findings to your decision making, let's consider that comprehensive documentation is essential for supporting the clinical decision making, and especially for ensuring the continuity of care, and for facilitating clinical validation. When someone comes back to audit for clinical validation and pay that claim, or whatever other reason the audit is for, they need to see those steps and see what was done. And because you might be meeting regulatory or other compliance requirements there also. Accurate and complete documentation provides a clear record of the patient's condition and the rationale for clinical decisions, which is critical for quality care and legal protection. So basically, even if you did it, if you didn't document it, you didn't do it in the eyes of whoever's auditing that chart. Okay. So for example, you can document the patient's symptoms, physical exam findings, diagnostics, and treatment plan comprehensively in the medical record. This supports the clinical decisions made and provides a reference for future care for other providers. Clinical validation also involves confirming that the diagnoses and treatments are supported by clinical evidence. And this is a crucial aspect of healthcare documentation. It ensures that the patient's medical record accurately reflects their condition and the care provided. You're kind of an artist. You're painting a picture of what happened with that patient with your documentation. Steps to ensure clinical validation include a thorough assessment, accurate documentation, and regular review and audit of medical records. You can validate a diagnosis of pneumonia by ensuring documentation includes your clinical findings like fever, cough, lung auscultation, imaging results like chest x-ray showing consolidation, and what was your treatment? Antibiotics? So clinical validation requires a multi-step approach. First, your thorough assessments to gather your relevant data. Second, your documentation of your findings, which accurately and completely represents them and supports your diagnoses with the clinical evidence. And thirdly, having a regular review and audit of your medical records to correct or identify any discrepancies, which would lead to education and training on clinical validation for any and all healthcare providers to maintain the high standards of documentation. Things change in our world, and it's important to keep up to date, isn't it? So regularly reviewing medical records to ensure that all documented diagnoses are supported by clinical evidence verifies that a diagnosis of congestive heart failure, for example, includes supporting clinical findings such as edema, elevated BNP, and echo results, echocardiogram. Okay, so let's consider a case study to integrate the assessment findings. Our patient is Mr. Johnson, who presents with multiple symptoms, including fatigue, shortness of breath, and chest pain. We gathered and synthesized data from his history, physical exam, and diagnostic test and identified potential underlying cardiovascular condition. Based on these findings, we developed a comprehensive treatment plan that included medication, lifestyle modification, and further diagnostics as needed. Mr. Johnson's case involves integrating findings such as his history of hypertension, physical exam findings of JVD, jugular venous distension, and diagnostics showing elevated BNP and reduced ejection fraction on his echocardiogram. I want to add to that, we'd want to include details like any right or left heart failure, ejection fraction percentage, things like that. We want to clinically validate whatever diagnosis you come up with there and be able to provide the highest level of specificity on the type of congestive heart failure. So the findings led to the diagnosis of congestive heart failure, hopefully more specific than that, and the development of a comprehensive treatment plan. To ensure high quality documentation and clinical validation, it's essential to follow best practices. Consistency and accuracy are crucial, as is the use of standardized terminology. Make sure that entries are timely and complete, capturing all relevant information. And continuous education and training on documentation standards and clinical validation are also important to maintain high standards and keep up with changes in best practices. So let's talk about best practices. Documentation and validation can present various challenges, including time constraints, incomplete information, and discrepancies between different sources of data. So we need strategies to address these challenges, like electronic health records, which streamlines documentation, regular training sessions, which you can reach out to your experts, like those at Innovation Health, to conduct regular training sessions, and foster a culture of teamwork to open communication among healthcare providers. By working together and supporting each other, we can overcome these challenges and ensure accurate and comprehensive documentation. So again, since I'm running out of time, I would like to conclude with just integrating assessment findings into clinical decision-making is essential for providing high-quality patient care. Thorough assessments, accurate documentation, and clinical validation are key components of the process. By continuously improving our documentation practices and ensuring clinical validation, we can enhance patient outcomes and meet regulatory requirements. I'd like to thank you all for your valuable time and your attention, and I encourage you to apply these principles in your daily practice to improve the quality of care that you provide. And please remember not to hesitate to Send any questions or discussion you might have either to my email or leave your comments in the comment section chat on the video. Any questions, discussion you have about integrating assessment findings into clinical decision making. You could discuss any challenges you faced and possible solutions. Let's all help each other. Your feedback and insights are valuable for improving our practices and ensuring high-quality patient care. And there's the email. Bye-bye.